Overdose deaths in Louisiana are on the rise. The state saw the highest increase of any other place in the country behind only Washington, D.C. Nearly 2,000 people died of an OD just in our state. As Paul Dudley reports, the uptick is largely associated with the COVID-19 pandemic.
Last year with the pandemic, we saw a dramatic spike in overdose deaths across the country, but particularly here in Louisiana.
The numbers are coming from the Centers for Disease Control and Prevention, and they show Louisiana saw a 54% increase in overdose deaths in 2020. In 2019, there were 1,186 OD deaths. In 2020, there were at least 1,826. Dr. Ben Springate with LSU Health says the jump has a lot to do with the COVID-19 pandemic.
People were isolated from their treatment options. People were isolated from their support groups. Many people had financial difficulties, and these stressors led people to go back to unhealthy using habits.
We asked the Drug Enforcement Administration in New Orleans about the uptick in drug overdoses. They say it's the worst they've ever seen.
It's the biggest epidemic we have seen, those of us involved in drug and law enforcement and those that are involved in drug prevention and addiction. We lost over 80,000 people last year to drug overdose. Our nation has a drug overdose epidemic.
The DEA attacks the problem from the enforcement side, where they disrupt drug trafficking organizations. They also help regulate the amount of prescription drugs being prescribed. And furthermore, they host community events like Drug Take Back Day, where people are encouraged to drop off unused prescription drugs. Doctors say these events can make a difference.
Certainly, if we can reduce one overdose death, imagine the impact on that individual family. So, when we can get hundreds or even thousands of pills out of circulation and away from people who might be at risk of overdose, that can make a huge impact for that family or for families here in our community.
Paul Dudley, Eyewitness News.
We also know part of the problem has to do with fake pills. The DEA says in some cases someone might be buying what they think is a Xanax pill, when in reality it is laced with fentanyl, which is 100 times more potent than morphine.